Hi everyone, my name is Yardern and the genetic disorder that I will be covering is Kallmann syndrome. So first, I will describe the history of Kallmann syndrome. It was officially identified in 1944 by Franz Joseph Kallmann in a published paper in which he described 11 people within three different families, and all of these people lacked testicular development and lacked a sense of smell, which, as you will see, are key characteristics of Kallmann syndrome. With that being said, in 1856, a Spanish doctor called Aureliano Maestre de San Juan first described a connection between hypogonadism and anosmia, which is associated with Kallmann syndrome, as you will see. Further, in regards to prevalence, Kallmann syndrome is actually rather rare. It's more prominent in males than females, with 1 in 30,000 males having it and only 1 in 120,000 females having it. Now onto the major characteristics of Kallmann syndrome. For both males and females, there is an altered sexual development, whether this is delayed or incomplete puberty. As a result, individuals with Kallmann syndrome do not develop secondary sex characteristics. And as part of the delay or lack of puberty, people with Kallmann syndrome often lack growth spurts, often being shorter. And another main characteristic is an altered or complete lack of smell. And beyond these common effects, there are some others, which include cleft palates, bone abnormalities, hearing loss, and incorrect tooth development. As you can tell in this photo on the right, here are some common symptoms associated with it within photos and what people with Kallmann syndrome often look like. Furthermore, the physical effects of Kallmann syndrome actually also differ based on the sex that an individual is born with, and for males, they often have a micropenis, while undescended testes, no facial hair, and their voices often do not deepen, while for females, they do not start their menstrual cycle, and they often lack breast development, which, as we know, these physical effects are often a result of undeveloped puberty, which is a key characteristic of Kallmann syndrome. To continue, the molecular cause of Kallmann syndrome is wide due to the fact that there are a variety of genes responsible for the condition. In fact, there have been 20 plus genes identified and more possibly today. So the most common ones are ANOS1, CHD7, FGF8, FGFR1, FROC2, and PROCR2. And the chromosomal location that's associated is the X chromosome, which is actually primarily associated with the ANOS1 mutation I previously mentioned. So for the mode of inheritance, due to the fact there are so many genes associated with Kallmann syndrome, the mode of inheritance actually depends on what the gene mutated is. So the most common mode of inheritance, as you can see on this slide, is X-linked recessive pattern, which results from an ANOS1 mutation. In this photo, you can see what this specifically looks like, but for males, they only need one mutated copy to get the disease, and females actually need 2 copies of the mutated gene. So as a result, the father cannot pass Kallmann syndrome onto their son when the mode of inheritance is an X-linked recessive pattern. To continue, another mode of inheritance is actually autosomal dominant, in which one copy of a mutated gene causes the disorder no matter who the parent is. So the person affected can be the mother or the father. And a final mode, which is a lot less common actually, is the autosomal recessive mode of inheritance. And in this case, both copies need to be mutated, and people with this type of inheritance pattern often do not show signs and symptoms for Kallmann syndrome. And here you can see both autosomal dominant and autosomal recessive and how they affect their children, and who would be affected based on what parent is infected. So to continue, here is an example of a pedigree representing the autosomal dominant mode of inheritance. And all the boxes in red indicate someone with Kallmann syndrome. And as you can tell, it's originally passed down by the father, Samuel, and spreads throughout the generations. Generation 1, 2, and 3. So now options for genetic testing. So there are a variety of tests that can be used, and according to Medline, there are 7 different genetic test options. So these actually differ based on the specific genes they're testing for, but they're all similar tests with different variations. So there are variations of hypogonadism with anosmia tests, whether this is hypogonadism with anosmia test 1, 2, or 3, or Kallmann syndrome 1. They differ, but they're all testing for rather similar things. And these genetic tests often test for ANOS1 mutations, FGFR1 mutations, PROC2 mutations, and BRCA2 mutations most commonly. But the majority of the genetic testing options in general for Kallmann syndrome are actually molecular genetic tests. So when and why should people be genetically tested for Kallmann syndrome? Well, in regards to when, it's often tested around puberty, but can also be tested and done on newborns if they express physical symptoms of Kallmann syndrome or have a relative with it. So for females, if it's tested around puberty, they'd be tested around 11, as this is most commonly when puberty occurs for them. But for males, it would be around the age of 12, as this is when it occurs for males. But why is it done? So testing is done because it'll help and improve patient care once it's known if an individual has the condition or not. So it can help treat the symptoms, make it more manageable of a condition when we know the genetic basis. Similarly, it also helps prevent further complications, one of which is infertility. Infertility can often be worked around or delayed if it is tested and confirmed, so it really can prevent it further on if someone is known to have it during puberty or during the newborn stage. And it also helps in general, but with that being said, genetic testing is not mandatory unless you're trying to have a child or are going through the infertility process. So that was my presentation overall, and I really hope you all enjoyed it, and here are my sources. Thank you so much.